Hello everyone, happy Friday. It's me again after being out and MIA for way too long. I'm going through many life changes. As you can already see, there's a different background. I promise you it'll be better next time. So, it's been crazy. So I'm so sorry that I have been absent, but today we're going to review a very, very great article about walking after a spinal cord injury. In this article, I actually linked it on my bio, and it's called Who is Going to Walk? A Review of the Factors Influencing Walking Recovery After a Spinal Cord Injury. And this is by Giorgio Ciboletto et al. This article is free. If you type, Who is Going to Walk SCI PDF, you might be able to find it. If not, it's on my bio. So I love this article, and if you are planning to study for your NCS, I highly recommend this article. This is one of those articles that you might find, like, oh my gosh, this is so interesting and that makes so much sense, or, it's one of those articles that you just need to know. So I'm gonna go over some of the greatest points from this article that I thought they got stuck in my mind. Okay, so first thing, this was a systematic review. So the authors were searching papers mentioning spinal cord injury and walking. So pretty much this article talks about those specific factors that are a good indicator for, the walking recovery after a spinal cord injury. Because after spinal cord injury, the first thing that your patient might ask you, after you're working with them through, their therapy processes, what's the chance that I'm going to walk again? And, it's important to you to know, what to answer and not be like some doctors that are like, never, right? So, there's a lot of research saying, if you have this level of injury or, this level of ASIA score, it might convert. So this article talks all about it. So the first point that I really love is that the most relevant, and I'm going to be reading some things, that's why I'm going to be looking down. The most relevant prognostic factor for functional recovery in spinal cord injury patients is the neurological status at the time of the first exam. What does that mean? So that means, your ASIA exam, your International Standards for Neurologic Classification of Spinal Cord Injury. So pretty much, your ASIA exam. So I love, even though it's a lengthy exam, but I love just doing my ASIA. I love practicing. It's challenging every time for me because I don't work a lot with spinal cord injury, so I love practicing my ASIA. You learn so much through the process of testing. So basically it just says, do the ASIA, right? Like this exam need to be done within 72 hours. And this article mentions that time frame. This examination should usually be performed at 72 hours after the lesion, okay? So keep those 72 hours in your mind, okay? So that's gonna be the most relevant prognostic factor for functional recovery in spinal cord injury, okay? So, that's the first thing this says. The next thing, it starts talking about ASIA grade conversion and walking recovery. So pretty much it talks about patients with ASIA A or AIS impairment A. That is the motor complete. If they have an ASIA A at their first examination, they have very few chance of neurological recovery below the lesion. So let's say when the examination is performed at 72 hours post-injury, 80% of people with ASIA A will remain ASIA A, okay? So, and 10% will convert to ASIA B, and about 10% will convert to ASIA C. So there's a chance, however, most of that percentage will stay ASIA A. So the achieving functional walking, it's limited in people with ASIA A. Now, ASIA B or AIS impairment B, which is your sensory incomplete, Usually they show some motor recovery and they can convert to ASIA C or even ASIA D. So the walking recovery is about, I mean, it's higher than ASIA A, so it's about 33% for ASIA B. Now here it mentions something that I just loved from this article. So it talks about how a specific modality or sensory modality, how a specific sensory modality needs to be just, you need to keep in mind. If there is a preservation of pinprick, which means, pain, that is a good, prognostic factor. And you might be like, why? Well, if you take a look at the spinal cord, your spinothalamic tracts are very close to your cortical spinal tracts. So if let's say here's a pinprick and here's the cortical spinal tract, right? If you have preservation of pinprick, then most likely you have preservation of some cortical spinal tract. So that means, you have the potential to recover some motor function, okay? So pinprick preservation, people with, or ASIA grade B patients with pinprick preservation have a better walking recovery than those with light touch only, because light touch is in the back of the spinal cord, so DCML, okay? So here again, it mentions this finding has an anatomical basis at the spinal cord. The preservation of pinprick indicates less extensive damage to the spinothalamic tract. Okay, so that's why. Now, motor incomplete or C. So these patients have better prognosis for walking recovery than ASIA B or just ASIA B or A. So the overall rate for walking recovery, it's 75%. Like, that's a lot. So now this percentage includes people that converted to ASIA D or people who remained in ASIA C but got some walking function back. So probably these patients had a low thoracic or low lumbar lesion, and they were able to walk with braces or orthotics. So 75%, wow, that's pretty amazing. And lastly, you have your ASIA D, which they have pretty good walking recovery. The chance of achieving functional walking is about 80 to 90% in ASIA D. So, here is a ton of information that you can tell your patient, there's a lot of research that says, if you have this level of injury, there's X percentage of probability of you walking again. Or, your ASIA level might change to a better one. So, here is, you go, I mean, this is just a summary, but you can read this whole article and it just has a bunch of good information. It also says ASIA D patients at admission, so 72, okay, have very good ambulation prognosis at 1 year post-injury. So very, relatively quick, right? Lastly, it starts talking about syndrome. So if you remember your central cord, your Brown-Séquard, your anterior cord, if you don't, go ahead and look at the video that I posted a couple of, I think it was months ago. But here, it talks about central cord syndrome. Now, central cord syndrome, the injuries in the central part of the spinal cord. So that's where all the cervical tracts are located, because our legs are more lateral and then our upper, it's more like medial in the spinal cord. So you have more involvement of the upper extremities, so not a lot of involvement of the lower. So that's why they have good prognosis for ambulation. Brown-Séquard also has pretty good prognosis for ambulation. The one that has the worst prognosis for ambulation is your anterior cord syndrome. Why? Because anterior cord involves the lateral and anterior part of the spinal cord, and that's where the cortical spinal tract and the anterior thalamic tract are located. Tract are located. So that will impact, the motor recovery and, your pinprick and all those sensations, okay? Because they have preservation only of the DCML, which is the posterior part of the spinal cord. So they have the worst prognosis for ambulation. Some other things that they mention in terms of like prognostic factors are like the strength of the legs, the strength of the MMT scores summed together, some reflexes. So I'm just gonna go really, really quick into them. If you wanna just know more about them, please read the article, because just for the sake of this video, I cannot make it too long. Instagram will be mean. It won't let me post it, but it talks about how the MMT scores are very important. So you know how on the ASIA test, you have like some little squares where you put like the muscle grade score. I don't know, like here in this area. So, you know, you put like 5 or whatever it is. So here it mentions how the muscle grades are important. So the sum of the points, so here mentions, you know, all patients with an initial, which is 1 month, lower extremity motor score, because we're talking about the legs because we're walking. So lower extremity muscle score, motor score, sorry, or LEMS of more or equal to 10 points MMT ambulated in 1 year. So that's something that you just need to keep in mind, and it's in this article. Also, it says that quadriceps strength is an excellent prognostic factor for ambulation. So yeah, I mean, this article is full of like those little nuggets that you're like, oh wow, this is, you know, interesting. And lastly, I want to talk about this interesting thing, the delayed plantar response. So when you're doing your very early examination after a spinal cord injury, patients present with the presence or an absence of a delayed plantar response. So this is like a delayed response to a strong stimulus to the sole of the foot. So you know, it's very similar to the Babinski. And this is really relevant when you're talking about like the spinal shock phase. So if they have a delayed plantar response, this is a negative prognostic factor, as it is often present and lasts longer in people with spinal cord injury who do not recover any voluntary movement. So that's the article. Okay, I love it. This is one of those articles that I remember when I was studying for NCS. So please check it out. It's going to help you during your spinal cord injury study sessions. It is an article that you need to know for your studies. You need to know as a clinician. Great article. So I hope you guys enjoyed this video and learned a little bit more about spinal cord injury and walking recovery. And I will see you next time when I am more settled down. Bye.